Good evening, and welcome to first week in Men's Health Month. This month, Health Ministry, in collaboration with Men's Ministry, is going to be putting on Men's Health Month, and we're excited. We say it's Men's Health Month, but we're very happy to see a lot of ladies, and during our promotion 2 Sabbaths ago, we said we want the ladies to bring the men here. And we're so thankful that you ladies have brought the men here, right? So we're hoping that it's going to be an exciting month. We got a lot of things planned. And we have some refreshments as usual at the end of the service in the fellowship hall. So we want you to stay afterwards and just fellowship, all right? And without any further ado, I'm going to have Dr. Allen introduce our speaker for this.
Without ado, huh? All right, guys, hi. As Andy said earlier, June is Men's Health Month. I'm not going to even dare with this, but men, our tendencies a lot of times is to neglect our health. And as Andy was saying, if it wasn't for the women a lot of times, most of us wouldn't find ourselves in the doctor's office. And so it's important, and there are issues that affect men. And the statistics says that the #1 killer of men in the United States is heart disease. And we're going to address that topic today, but we're going to address over the 3 series. And we're going to be here June 5th, we're going to be here next week, June 12th, and we're going to be here on June 26th. Next week, we'll be talking about cancers. The actual #1 cancer for men is actually lung cancer, but we're going to discuss something a little closer to home, which is prostate issues for the guys in our age group. And for the younger guys, we'll be talking about testicular cancer. And a lot of people don't even know that there is a way that you actually can check yourself for this. And so Dr. Taylor will be here next week talking about that. And then 2 weeks hence, the third thing that kills men is unintentional injuries, which you wouldn't even think of that, but actually a lot of it is job related, and a lot of it is just because men take a lot of risk. And so we have a psychologist, Dr. Kenny, can't remember his last name off the top of my head, who will be here on June 26th talking about the psychology of men and why we usually end up with dying from unintentional injuries. But tonight's business, tonight we have here Dr. Lucia Blanchard. Everybody knows Arno, and Dr. Lucia is famous in her own right, and she's actually currently a fellow of cardiovascular disease, about to be done in 3 weeks. So I want to keep praying for her. She's gotten married, had a baby, and all this while doing this program. So kudos to her, and God bless you. So without any further ado, please give a Plantation welcome. She's a member here actually, but just welcome Dr. Blanchard to talk about heart disease. Don't forget your song. You need this mic or you? Okay.
Can I move around then? So is this working? Okay. So yes, I am Dr. Blanchard. I'm Dr. Arno's Blanchard wife. Pretty much everybody knows me like that. So I would like to, be for once Dr. Lucia Blanchard. So let me tell you a little bit about myself before I start lecturing you on things and tell you how to do things, so you know my background. So I graduated from Nova Southeastern University. This was 6 years ago. I did my internal medicine training at Broward Health Medical Center, and then I continued there to do my cardiology fellowship. Yes, I met my husband there. We got married and we have a daughter. Her name is Aria, and she's just gorgeous. I'm happy to be here with you, although I should be home breastfeeding. But there are lots of important things that we have to do. So before I start, actually, I see them over there, or where do I see them? Okay, I thought they were in the front. Okay, so I want to talk to you about cardiovascular health. It's very important. people don't even think about it. We know that it's the #1 killer in the United States. Most of the people actually don't even realize that how important it is to prevent this terrible disease. There was recently a search done on Google on how people, what people search for when they look online. And most of the people look for cancers. They don't care about cardiovascular disease, although it is the #1 killer in the United States. So, yes, that's my husband there, Arno Blanchard. I promised him that I'll come and do this lecture if he does the slides. So, yes, he did them. So, as I mentioned, #1 cause of death in the United States. So, as you see, it is, doesn't work? Okay, it just goes back and forth. It's not working? Okay. So, can we go back to the first slide? So, as you see, the death number is really high when you look at the cardiovascular disease, and followed by cancer, and then there are other things. And it's pretty much equally in men and women. I know this is the Men's Health Month, but women also play an important role in this. And usually they are the ones that go undiagnosed. I don't know, because we are tougher when it comes about chest pains and all that, but we don't know exactly what's the reason. So, this one, right? Big one, okay, perfect. So there are lots of studies that have done, that were done regarding the exponential increase in risk in cardiovascular disease, and it's based on the risk factors. So there are lots of risk factors. High blood pressure is one of them. Many people don't even think about high blood pressure because you don't have a symptom that you experience. You don't have chest pain, you don't have shortness of breath with high blood pressure. Eventually, as an effect, you might develop these symptoms. Smoking is a big factor, diabetes. There are many patients who don't even realize that they have high glucose levels until they see an end organ damage. What that means, they start having kidney disease, or they cannot see, or they have a stroke, which is the worst outcome. Also, when you have these factors combined, like 1 or 2, 3, you can see that your risk actually increases 26-fold. So it is important to recognize them. Overweight or obesity added to these risk factors increases even more your chances of developing cardiovascular disease. But what is cardiovascular disease? Myocardial infarction, like having a heart attack, is one of them. Stroke, heart failure. So those combined also increases the risk of death. So we know it's a very costly disease. It costs us like 431 billion annually. So you imagine if we could prevent this, we would save some money, and then the insurance, wouldn't cost that much. So you can see the prevalence of the hypertension is very high, and as I mentioned, lots of patients don't even realize they have high blood pressure. Sometimes they will have experienced some headache, and maybe that will kind of point in a direction. But what we see earlier now, it's even the youngest have high blood pressure, because now they are obese, and also, many of them, they eat at McDonald's. I don't know, I didn't grow up with McDonald's, so that's one thing that you have to always, be considerate of with your children. Stroke is there. Heart failure and atrial fibrillations are another risk factors that increases your risk of that. But in overall, hypertension is a big one. So you can see, if you have a diastolic blood pressure or systolic blood pressure above 115/85, your risk is already high. So you would think that this is a normal blood pressure, right? So it's a sorry, what am I doing? Okay. I don't know, I feel like I'm going forward instead of backwards. It just goes forward or doesn't go backwards? Sorry about that. Okay, here we are. So if you have a blood pressure above 120, you're already having like a high risk of cardiovascular disease. And like I said, most of us don't think, you think you have a normal blood pressure and it doesn't carry any risk, but it does. So when you are in this range, there is time to do something. You want it to be lower. If you are someone who has a blood pressure of 90/60, and then suddenly you go to Walgreens and you check your blood pressure and you realize it's 120/80, you already realize that it's 30-point increase. So there is time to maybe see a doctor or do something, change your diet, exercise, lose weight, if that's the problem, smoking or all those things. So as you see, your mortality, too bad I cannot show you, on the graph you can see as you increase your diastolic or systolic blood pressure, there is a higher risk, a higher absolute risk of dying. So you would say, oh, well, I don't, I have, there is a risk, but maybe it's not me, that person who will experience an event. So it's not just the high blood pressure, it's also the company it keeps. We know that 69% of the first myocardial infarction are associated with high blood pressure. So the only risk factors that these patients had, it's that, the elevated blood pressure. 74% of the cases have heart failure. So we know that hypertension increases your risk of developing heart failure, like by 2 to 3-fold. Usually, these patients with heart failure present with shortness of breath. They said, oh, I could not sleep last night because I had to wake up multiple times. And you would think, oh, maybe it's stress or it's insomnia, but maybe it's the shortness of breath that it's bothering these patients. 77% of all first strokes are associated with high blood pressure. Many of the patients that come to the office, they say, oh, I don't need to treat my blood pressure, I don't need it. And they ask, what's it going to happen to me? Well, maybe you'll have a stroke, and they will become debilitated. You won't be able to walk, to talk, to enjoy, basic life. So it is important to treat that blood pressure. And there are many ways. Some people choose it more naturally to lose weight. Some people have to be on 2, 3, 4, 5 blood pressure medicines because we cannot control it. But just saying that, I don't have to do anything about it, probably you have to do. There are about 300,000 US deaths annually associated with high blood pressure. And then the costs are like 66 billion annually. Imagine that's a high amount of money just, associated with this high blood pressure, which we could prevent, and we could, measure our blood pressure, maybe not daily, but maybe weekly, monthly, if you're, that person, depending which range you are in. So, again, this was a study done by Kaiser Permanente, and look at this high blood pressure, how it is usually associated with other risk factors. You have high blood pressure, but it's not just the only thing you have. You have other things. You have obesity. You have maybe your cholesterol is high, or maybe you have diabetes. So when you look around, in this pie chart, you can see that only, like maybe 49% of the people had hypertension only. All the rest of them, 60-something%, had, other risk factors, at least one. So it doesn't work just alone. It comes with a company, it has a company. So what are the mechanisms that actually lead to this? And these are the things that you don't even think about on a daily basis because it's kind of hidden in our lifestyle. So what is happening? You eat food. You eat pizza or French fries or a hamburger at, I don't know, Burger King. And it's a stress on your body. So what is happening? Your sympathetic system is activated. So it's exactly the same when you are like, flight or fight. You are scared of something. You're stressed. So that activates the vessels in your heart. So you start having like resistance in those small arteries. The system, it kind of builds up, because you're having more retention of the water, because of all the salt that's in there. You start increasing your cardiac output. Now your kidney sees more pressure, more volume. And there is, like it's like you never know what's the beginning and what's the end of it. It's the chicken or is the egg. So you develop this, the vessels of your, and they see this high cardiac output, they start remodeling. So they become thicker, which is not a good thickness to have, right? So that's leading to hypertension. So now the heart sees this high blood pressure. It has to pump stronger against that high blood pressure. So now you have thickening of the heart. Sometimes it fails. You develop heart failure. So it's a cascade of events, okay? It's not just the vessels of your heart. It's happening in the kidneys, happening in the brain. You have high pressure in the brain. You start developing strokes. And that's how it goes. It's just like a never-ending circle. In contrast, if you eat a healthy diet based on vegetables, fruits, what we call the DASH diet or Mediterranean diet, nuts, everything that's healthy. We all know what's healthy by now. Actually, your sympathetic system is not increased. It's kind of at a lower level. So now you're allowing your body to do physiologically what it's supposed to do. It's to function at the normal level. You don't have to increase your blood pressure. You don't have to, the kidney don't have to see all that high pressure and all that volume that comes with stress, water retention due to salt intake. You guys don't see this, right? So this is like a chart. Maybe we can just send like this chart to everyone. This is a chart that tells you how every food, what you should eat every week, like healthy diet, foods that are low in sodium, less than 1.5 grams per day. But I'll tell you a trick. It's very hard. If you go to a store and you look at the labels, you'll see that everything has salt in this country, like everything. My patients with heart failure, they come and they say, oh, doc, I eat very healthy. Oh, I don't put salt on my food. But it's not really the salt that they put on the food. It's actually the salt that they, that's in these processed foods. And they develop heart failure. And they say, oh, I'm compliant. I'm watching my water. I'm watching my salt. I'm watching this. But it's really not true. If you want to really do a healthy diet, a plant-based diet, I'll tell you something, you really have to put yourself to work because you have to cook from scratch. Otherwise, it won't work. And, even normally, when you eat these processed foods, you start accumulating that salt, and the body retains this water, and it's hard to lose weight. As much as you want to, you will be having difficulties. So diets, like heavy in fruits, vegetables, poultry. I know we are Seventh-day Adventists, we are more vegetarians, but there are many people out there that still eat meat. If you can transition yourself maybe from turkey, fish, it would be a good thing. Nuts, it's also another good source of protein. Low-fat diets with pretty much unsaturated fats. So everything pretty much out there is polysaturated or monosaturated. So other things that you can do is like do your weekly shopping and then, read labels. And you'll see how much of salt you eat. And it will help you also with your blood pressure. Because most of the people have high blood pressure because, like I said, they retain the salt. Now, I don't want to talk about the Jamaican food or Haitian food. I eat Haitian food, and I'll tell you that's full of salt. So unless you can substitute that salt with other spices, that's the only way you can do it. Even if you cook from scratch, there is no way because it's lots of things in there. So it is difficult. So when you look at this DASH diet and what's the effect on systolic blood pressure? So what's the systolic blood pressure? It's usually the higher number. You know, the blood pressure is 2 numbers, so the one that is the higher number, that's the systolic. So if you look at the blood pressure with a typical diet, like high in sodium, you can see that the mean is like really higher. It's around 135, 140. When you eat a diet low in sodium, which is the DASH diet, then you have a blood pressure, it's already like about 10, 15 points lower. So, you know, when you're 25 or 30 years old, that doesn't matter because the body can, you know, work it out. Not in everyone, you know, because there are some people that already have the genes against them genetically. They already have some mutations that kind of stimulate them, you know, towards obesity, towards high blood pressure. But I'll tell you something, if you're an active person, you know, in your youngest age, you're not going to have too much blood pressure, which, like I said again, it's changing now. So if you do sodium reduction, so again, it tells you how many points you can decrease that blood pressure. So sometimes you just by doing a lifestyle modification, such as watching your diet and eating low salt diet, you can lower your blood pressure by 10 points. And this is an example of this. So if you do like an intermediate dose, let's say 2.3 grams, you still can lower your blood pressure, but it will be, you know, you will still have ways to go. But if you go to a lower salt diet with 1.5 grams per day, that definitely will kind of, you will be able to reduce the blood pressure with about from 3.5 to 9.8, it's about 8, 9, 10 points. If you lose weight, my goodness, that is like 11 points right there. So with losing weight, you know, watching your diet, adding some exercise there, you already did a lot. And you'll be happy with the results. You'll lose weight, you know, you'll be more active because of all the things that you do. So, I showed you the evidence. I don't know if you're convinced by now, but we all know what we can do with our diet and exercise without just showing you the evidence, evidence-based medicine that we have. So now we have to focus on what we do next, what we do for a good cardiovascular health. So like I mentioned, I just remind you again the risk factors that are there. So we have to modify those. Smoking, it's a no. Increases your risk, not just cardiovascular risk, heart attacks, also lung cancer, other cancers. Diabetes, you have to control it. Some of the patients that control diabetes with diet, exercise, they actually are able to come off of some of the medicines. My father is a diabetic, and then he came to the United States. He was on insulin 20 units when he arrived here. So with watching his diet and, you know, kind of forcing him every day to go for a walk, so now he's actually on 8 units of insulin. So my goal is to take him off, lose a little bit more weight. So that's what we can do, you know, with a little bit of, you know, I don't know, a little bit of motivation. Obesity, as I mentioned, losing weight, it's important. I think that's the hardest part of all. So if you tell someone, go lose weight, they look at you, yeah, sure, you know. I don't think so I'm going to be able to do that. It's not that easy, and it's not. I will tell you the truth. I'm trying to lose 10 pounds since I was pregnant, and it's not working. So every day I'm battling that. But I know why it's not working, because I do not eat as I'm supposed to eat. I'm always in a hurry, which all of you do, because that's how our lives is. I don't exercise because I don't have time, so I have to do those things. And I know I will be able to lose weight. Now, another thing that you would say, well, you know, I'm at work, I'm always active, I'm running around. Yes, I go around a hospital, probably I walk 4 or 5 miles a day. You know, I use the Apple Watch to see how active I am. That's not exercise. Exercise is that you do 30 minutes of moderate intensity, you know, you go walk for 30 minutes at a good pace. That is exercise. Okay, so that's a good excuse, that you are active at work, but it's not. So this is just a reminder for you. So like I said, lose extra pounds and watch your waistline. So we females have a tendency to have abdominal obesity. That increases your risk by itself of diabetes and other cardiovascular disease. For some reason, this fat that gets stored in the belly, it just increases the resistance in those small vessels and causes hypertension. To exercise regularly. So how often do you think you should exercise? Every day. Every day, it's just ideal. If you can do 30 minutes 5 times a week, that's perfect. You will lose weight. But exercising as like just I'm going to walk the dog, that's not exercise. You have to go to a very good pace. People who have, that they maintain a good level of fitness, usually they exercise 80 minutes a day. So 80 minutes if you want to maintain that weight. And then you have to remember also as we age, our metabolism slows down. But we have the tendency to eat like we used to eat in our 20s. And as we become more static, actually we eat more. So if you look at our plates, they're definitely bigger than they were when we were 20s. And we are less active than we were back then. So that's another thing that you have to take in consideration. Eating a healthy diet, it's also a habit. You have to have a breakfast. You have to start at least 1/3 of your meals should be a breakfast. You should, make eating a lifestyle. Not eating in front of a TV. Have like a nice conversation with your family at dinner time or lunchtime, whenever you can. Reading while you're eating, believe me, you will forget about what you're doing and you will keep eating and eating. Playing video games or like, eating should be eating, should not be associated with any activities. Reduce sodium in your diet. I think I spend a lot of time on this. You will do that only by reading labels, but you will do definitely that if you cook from scratch, which is a huge task. So 1,500 milligrams, it would be ideal if you can, reduce your intake to that. Even if you don't have to, lose weight, or even if you don't have high blood pressure, it's good to have a low-salt diet. There are many other spices out there that actually can substitute for that salt. People do not know the taste of other things, so unless you try it, you will never know. Limit the amount of alcohol you drink. I know we are, Adventist and we don't drink, but you will be surprised. Some people drink. They drink 1 beer or they drink something. Well, beer has lots of salt in it. Now, like American Heart Association said that actually made a statement about that moderate amount of alcohol are okay. But now we have studies that say no alcohol, it's good for you. So you should not be drinking at all. Smoking, that's a big no-no. Smoking, I don't have anything to say about smoking. It's promoted everywhere as do not do it, right? We cannot smoke around the buildings because it's not allowed. Even in my home country, you cannot smoke anymore whatever you want. So it is a good thing. Cut back on caffeine. That's another thing. It's a stimulant. So it will increase your sympathetic system and leads to other chain of events. Okay, this one, reduce your stress. That's a big one. Well, it's hard to do. You can pray, you can do all sorts of activities, go for a walk, but it also comes from our mental health. So how we reduce our level of stress, it's an individual thing. Some people need help with that. Professional help or help of the family, but it's important to reduce the stress. Monitor your blood pressure on a regular basis. So if you look, you check your blood pressure once a month. Maybe you can go to Walgreens or even if you just pass by, see, somewhere. Everybody has a cuff machine now. You can check your blood pressure just to see where you're at, where is your baseline. Maybe a year from now, you'll experience some event and you wouldn't even know, oh, what was my blood pressure? I had no idea because I never checked it. And when we are young, we have that tendency to get support. So getting support, it is actually a huge thing because you actually have to recognize that you have a problem. So support comes from everywhere, from a friend, from a stranger, from family, right? So let me give you an example of support. So you are on a diet and you try to lose weight, and then you are eating healthy, you're in the morning, you have your breakfast, healthy breakfast, lunch, breakfast, lunch is healthy, and you go to dinner time at home, and then somebody else in the family is like just eating, I don't know, McDonald's. So that's not a support, right? Your family members are not supporting you because they are bringing in your environment something that is not healthy for you. So eating healthy, it's a teamwork from all the family, from all the friends, in the church, everywhere. So that's an example of getting support. Now, another example of getting support is going to a nutritionist. Maybe you need somebody, a professional, to tell you, how to portion your meals, or how much protein you need in your meals, or how much carbohydrates you have to eat. Maybe a starter, meal plans. There are meal plans out there that you can do, It's a little costly. So what I have noticed, people who use meal plans, they use it for a while, and then they, if they have points or something, they do their own thing, and it's like a, less expensive option. If you like to cook, that's the best. How you learn to cook, you probably have to take some classes or like go online. That's how I learned to cook, I go online and then find out and then try things. It's fun to cook, So that's an example of getting support. So I think I went over all this. I'm just going to add to the exercise that, moderate walk is around 100 steps per minute, and vigorous, it's 139 steps per minute. So definitely exercise is a good thing if you do it right. Another thing that we know is that people who have low cardiovascular fitness that actually have increased risk of cardiovascular events and death. And why is that? Is because the disease just comes so easily to them. They usually have other comorbidities like hypertension, obesity, all that. If you are someone who is like overweight and exercise and had a good cardiovascular fitness, your risk is exactly the same as a person who's exercising and has like a normal weight. But even if you carry an extra weight, like the football players, some of them are like really overweight. I would say quite obese, but they are really fit because they exercise and they do, they do cardiovascular, fitness. So by now, you know what to do. If you have to do it. This is my husband says that. So you do it. He always says that. You have to do it, So I think my message to you is if you need help, we are here with everything we can help you. It's myself and my husband. I will have an office in Coral Springs, so I'll be closer to Plantation. So if you need help, or you guys have my cell phone, I think, some of you, and you can always call me and ask me what to do if you need help. Any questions? Yes. Red wine. Yes, that's true.
I'm hearing no form of alcohol is good. So my question is, what is the real deal in solving the cardiovascular problem?
Well, it is true. We had like lots of data in the past looking at these individuals who were consuming alcohol, and they were like, these are extrapolated from observational studies. They were looking, you know, at these people that they were drinking alcohol, and they were saying that 1 drink a day of red wine, it is okay. And that has been in the past. I never was convinced that something, that, affects your brain, your mentation, it can be good for you. Or something that actually causes heart failure, because we have lots of patients who have alcohol-induced heart failure. It can be good for you. The reason is because some of the people have different genetics than others. And then, it takes just one little insult to cause like an event, like heart failure, for example. So you have to be very careful because you really don't know your genes. You don't know where you are at. And then now later on, when we are looking at more data, we realize that 0 is the best for you. 0.
Coconut oil, for example, in one instance, you're told it's bad for you.
Mm-hmm.
It increases your cholesterol level.
It does.
In another instance, you're told it is very good for you. So at one moment, they have research.
Yes.
They research it, and in one moment, they say the research says, don't use the coconut oil. The next moment, research again says, have the coconut oil, it's very good for you. And Alzheimer's disease, it reduces the risk of having Alzheimer's disease when you use more coconut oil. So I'm a little confused.
I never ran into a research to tell me that coconut oil is good for you. There is lots of like, like, how do you say, like, traditional practices that they think that certain things are good for you, Lots of data came over the short period of time. Lots of data came from, young people, not like people who have other comorbidities or other disease, or we don't know the genes, how they work. So, yes, coconut oil, it might be good for your skin, maybe, you know what I mean? But definitely it can increase your risk of cardiovascular disease by increasing your cholesterol. So higher cholesterol, you have more chances of developing a plaque in your arteries, and then you develop a heart attack. The same with alcohol. Alcohol, some people do just well. Like you ask yourself why some people don't develop like liver failure, liver disease, right, from the alcohol. And some of them do develop that. So we really don't know because we are so different in all our composition. So the best is, to reduce all the insults. So if you live like a healthy lifestyle and a life, like more on, more plant-based diet, that's one thing that we have seen results. We had reports actually of people who had massive coronary artery disease, and they switched to a plant-based diet. And I have seen studies, like I'm talking about CT scans of the, cardiovascular calcium and how they, even if they didn't progress, they stayed there, And then I have these people who eat meat every day, smoke, drink, do all that stuff, and then 6 months later they come and have a massive heart attack. You can't even resuscitate them because they are so sick. Okay, people that we see in the hospital that they just die there because there is nothing we can do for them unless giving them a new heart. So it's personal experiences. Some people might say, "Oh, I feel good with coconut oil," or "I feel good if I drink a glass of wine every day," but that doesn't mean that it's good. Just because it's said, it doesn't mean that it's good. It's also common sense, But when we look back at these studies, we want to know what is the reality. But you can just like take every study that's out there. You have to look which population was this study done on, what were the comorbidities, what else was going on there in order to see if this study really works to you. You are that population. Does that answer your question?
Yes, in reference to her question on the effect of wine on cardiovascular health, I've read that it's an ingredient in the grape that really benefits the cardiovascular health. So in essence, eating grape would have the same effect without the alcohol put in.
So it's exactly, which is more healthier because you're actually eating fruits. Now, with grapes, you have to be a little bit careful because they are very sweet, you know, like watermelon. If you're a diabetic, you know, you will have to eat it in moderation. That's the only thing. But I'll tell you something. I never heard of fruits or, you know, a good exercise or a healthy. Actually, I'm retracting about exercise. But fruits causing you, you know, cardiovascular disease. Now, I have heard about exercise in the past. Not causing you disease, but if you have disease there, you know, it's another thing that you have to be very careful with when you start an exercise program. Because if you already have plaque there, when you start intensively working out, you can rupture that plaque and you can have a heart attack. So just like doing an activity that you say, oh my God, I'm like so brave, I can do this. You have to start slow and increase your exercise with moderation or under the supervision of someone who knows what they are doing. Okay?
And I'm just following up on the very same conversation here. So there's something that is known as fake news, right? And it really means that you have to be, which is what you said, you have to be very careful as to who's doing the survey. Because I can take data and I can twist that data to make it come out to be whatever I want it to be. And that's exactly how it works. Now, there's something that is called promotion. That's what we have a lot in America, where they promote certain things. They may be promoting coconut water, and then they tell you that it's good for you because studies, these you know, numbers line up to say X, Y, Z. So we just have to be careful. I think one of the best things to do is always trust your source. Know what source you're getting your data from versus just, I mean, you know, the internet is wide open. Everybody says whatever they want to say. You have to know your source. Mm-hmm. So. Definitely.
That brings us to, do you guys remember the vaccine thing? You know, that vaccines cause autism. And that was based on a study like 20 years ago that a doctor, you know, falsified the reports and they said that, yes, vaccines cause autism. And it just came out recently that actually he was lying. So you have to be very careful, you know. Just because a doctor said that this is true, it's really not true. You know, you have to really be careful. You look at the study, you know, look at the evidence-based medicine, and then you have to understand how to read the study. But, you know, you'll have to really be, you know, keeping a high alert on who is real and who is fake. Because that's the only way you will have, you know, you'll protect yourself in a way, right? Because anyone can sell you anything and say, do this, do that, do that. But just be careful with that, you know, that all this alcohol and all this you know, coconut oil and the traditional medicine, lots of herbs actually can cause you disease and can cause you, have bad effects on you. Just drinking a tea, it's not just the right thing. You have to make sure you know what it is. Because at the end of the day, it's a medicine, right? All medicines, we extract them from somewhere, from some herbs or plants. So just keep that in mind.
I noticed you did not include in the risk factors environmental risk. And I think
I did.
You did?
I said stress.
Oh, no.
Stress. The stress has many forms.
Yeah.
Yes. Stress can be, you know, a stress from outside. It could be noise. It could be anything.
But
any
you
sort
mentioned,
of stress.
okay, stress, but what about the pesticides and all of those stuff that does, because we can always eat diet as much as we want to diet, fruits and vegetables, and we talk about them, but if they are contaminated as exactly what is happening, they still, no matter how much vegetables and whatever we are taking, we are still going to get sick. So with all, and in addition, and I'm going to touch you a little, with these medications that are being prescribed too, it's helping in one area, but it's destroying us in another area. And we factor, yes, vegetables, and we stress it, but we're not talking about some of these medication that is causing more harm.
Yes, well, some of the medications have some side effects, that is true. But, you know, in medicine, we always balance what is the benefit and what is the harm. So if the benefit is greater than the harm, we go for it. So we want you to have like a nice lifestyle, like quality of life, you know, not like to be a vegetable and you cannot move, you cannot do things that you love. So that's how we gauge our treatments. Yes, sometimes we prescribe you Coumadin, it's a rat poison. But I will tell you something. Yes, it is. So I will tell you something. Having this medicine or having a stroke, okay, which one is it? I don't want to live with a stroke. I will tell you something. I would rather die than have a stroke. The things that I see and the debilitation, you become a vegetable. You're an adult that cannot function. So I would rather be a little poisoned here than have that. So that's what we're trying to do. I cannot hear. Which one?
Do you
Aspirin.
still recommend the 81 milligram aspirin?
Well, 81 aspirin I would recommend to people who are higher risk. If you are a person who doesn't have a high risk and your risk of bleeding is low, then I would recommend it. So if you have hypertension, diabetes, cholesterol, lots of risk factors that can bring you to us with cardiovascular myocardial infarction, then I would say yes, take it. But that would be looking at also area of bleeding risk, okay? Now, if you have cardiovascular disease and you had a heart attack, it's a given. You will take that for life. Well,
All right, we can take one more question for the doctor. Anybody else?
she had a question. CoQ10. It's a myth. Maybe it's good for your skin, but cardiovascularly, does nothing. No benefit based on our studies. And this was done on healthy population. Vitamins, the same thing. If you eat your vegetables and your fruits, you should get enough vitamins from there. Now, if you're a pregnant woman, like I was not long a time ago, you should have, of course, your prenatal vitamins. But otherwise, if you eat a healthy, you have a healthy diet and a good exercise routine, you don't need vitamins to prevent your cardiovascular, risks. If you want to do it for your own health because your hair looks better or your nails look better, then yes, take the vitamins, but not for the cardiovascular prevention. There's one more question. Can we take one more? Yes. Yes. It is. It is.
Good diet, but
I will tell you that I personally have a hard time balancing my diet because my life is crazy. I'm a mother, I'm a daughter, I'm a wife, I'm a cardiology fellow, I'm having a new job soon. It's the craziest thing. But, I learned something. When it's breakfast, I eat breakfast. At lunchtime, sometimes I skip. I'll tell you the truth. But you have to sit and down and eat. And then when you go to grocery store, don't go hungry, So, because I'm telling you, you're gonna buy things that you should not even be close by. So go to, when you're full, do your shopping, and you'll be surprised the things that you get. And then you can balance it, have at home, not sweets, have fruits. And when you're hungry and you're in a hurry, you can just really quickly take a snack, which is a fruit, an apple, or a grape or a watermelon. I love watermelon, so it's just like I can eat watermelon all day long. So that's what you can do.
But sometimes it doesn't satisfy your hungriness. You eat an apple, but you still very hungry.
But there is a way to do that. If you have a hunger issue, you can really balance it by occupying yourself with something. And you will see that your mind will move away from that hunger. If you notice that when you become busy, you eat something really quick, your mind doesn't think about hunger, it just goes away. But you have to be busy. You have to be doing things, not like waiting, okay, it's gonna go away. More you think about that food, it just like takes over your life. That's how it is. Mm-hmm. Yes.
Some kind of fat. to absorb them. Is that true or false?
I never heard about that. Your body should absorb everything, you know. It will absorb what it needs to. It will take things from your gut. The gut is there, you know, to provide you. It has, you know, lots of, you know, how we call it, villi, to absorb everything that you need. Okay, so what you don't need, it goes to waste. So do not think about that. Okay, unless there are some people who have like gastric bypasses, they have to take some fat-soluble vitamins because, you know, they lose some, you know, some portion of their gut. But don't think about that. It's absorbed. Unless you have a problem with your gut, then that's a different story. Any other questions? That's it? No more questions? Okay. Thank you.
I thank you so much. A big round of applause for Dr. Blanchard. Thank you so much, Dr. Blanchard. All righty, just a reminder. Where is this? Oh, okay. Blueprint for Men's Health, they're in the back. Also, while we're fellowshipping, we have little bit of soup and all that in the fellowship hall. While we're doing that, we're going to be able to check your blood pressure. If you're interested in having your blood pressure checked, we will do that at the end of this all. Right? We're going to get together in circle, and we're going to have our prayer requests. If you have any prayer requests, anything you want us to pray for, if you have any testimony, then we're going to do that right now.
All right, guys, I'm just going to. This little booklet is free for anybody who wants it. Please take it and give it to your friends, any men in your life who you want to see healthy. There's loads of information in here. I was actually looking through it, and it actually was still talking about the alcohol, saying alcohol is good for you with your meals. So, but, ladies and gentlemen, health is a stewardship issue, and we're all stewards. And it's important for us that we understand that our health is a gift. And as Doc was saying earlier, I don't care what medicine it is. All medicine is poison. It's just controlled poisoning, and there's a therapeutic value to every medication. So the less of which you can take, obviously the better it is for you in the long run. Anything else? So we're just gonna gather and grab somebody's hand.
Thank you for watching our live stream today. If you'd like more uplifting content, I invite you to go over to our website, plantationsda.tv, where you can find our sermons and praise and worship experiences archived.
Any prayer requests? Anyone with any special
praise
requests?
report or praise request
Anything you want us
that
to
you would
pray
like
for?
to give, I invite you to go over to our church website, plantationsda.org, where you can be able to enter your prayer requests.
Want us to pray
on
for
our
a knee?
site.
Anybody else?
And if you're ever in the Plantation, Florida area, we invite you to join us here for a live worship service.
Jesus with hip surgery.
Until then, may the Lord bless you and keep you.
Anyone else? Testimony?
Testing 1, 2. I just like doing that. Yeah, but thank you guys so much for the prayers. So.